We will discuss the complete crown preparation, its indication, contraindication, and some tips. The most out of these types of restorations. The longevity of complete crowns is superior to that of all other fixed restorations. They give the highest resistance than other types of restorations like the partial coverage ones, and they are used to cover a heavily restored teeth with extensive coronal destruction. Also, they are used for in these cases they are used as retainers for a partial dentures, where we have the seats here for the connectors. We use to prepare these types of grooves on the normal teeth, but they are impractical and insufficient. So covering them with complete crowns provide more retention for the denture, the partial denture. Also, one of the indications is for an endodontically treated posterior teeth, where we have lost a lot of tooth structure due to the endodontic access and the caries lesion in the first place before the endo treatment. They are contradicted in any other treatment plan that can be done with a minimum restoration rather than a complete crown. Now let's talk about the criteria that should be present in the preparation of the complete crown. First, we must have a minimum clearance of 1 millimeter of non-functional or non-centric cusps that are the mandibular, lingual, and the buccal maxillary, and 1.5 of a functional cusps that are the buccal mandibular and the lingual maxillary. Here we can see the reduction needed for the cusps. That is, on this side we have 1.5 and 1.5 on the maxillary, and in this side we have 1 millimeter and this 1 millimeter. As for the margin, it is a chamfer, and it should be at minimum 0.5 of a thickness, that it is an exact replica of half the rotary instrument that is used to prepare it. As always, it must be smooth and free of any irregularities. When we are preparing for a metal restoration, we need a 0.5 millimeter of a margin. For ceramic, we need a 1 millimeter of margin thickness. If we decreased this amount of thickness to become insufficient, the dental technician will over contour the restoration, which will increase the facial-lingual width, and it will cause periodontal diseases associated with this type of restorations. On the other hand, when we have a small teeth like the premolars, it is advantageous to prepare a slightly more conservative chamfer margin to preserve the tooth structure. Also, it is important to maintain the anatomical shape of the cusps and the occlusal surface of the tooth that is being prepared, and to prevent the straight surface by tilting the burr in the direction of the slope of the cusp. Now let's start with the preparation. These are the armamentarium for the complete crown preparation. We do the grooves, the guiding grooves with the tungsten carbide burrs. Then we start the connection between these grooves by the diamond burrs. Then we do the preparation and of the margin with a rounded, tapered diamond burr. Then we do the finishing of the margin with a more thickened burr. At the end, we do the smoothing with a red rounded burr, and it is preferable to have a wider type of this red finishing burr. We will see later why. So look at the picture here. We place depth holes that is 1 millimeter deep in the central mesial and the central distal fossa. Then we connect them that the channel runs the length of the central groove. Then we do the same thing in the buccal and the lingual grooves too, and connect them as well. We must be sure that the grooves are deeper for the functional cusps than that of the non-functional cusps. Here we see the grooves clinically. As for maintaining the accuracy of the preparation, it is recommended to do a half preparation either in the mesial or in the distal to have a reference that will facilitate the evaluation of the adequacy of the reduction. It is recommended that we do not go for the whole depth from the first preparation, which is the 1.5, so that we allow a more reduction or more space for the smoothing at the end. After we finish the occlusal reduction, we must verify the clearance of all exclusive movements that the patient can make, and so we maintain a space for the building of the restorative material later on. Another way to ensure the adequacy of the occlusal clearance is by making the patient to occlude on a softened wax, and then we measure it by a wax calipers to ensure that we get the adequate thickness. Here we follow the angulation of the tooth when we are preparing with the burr. This is the final shape where we have round angles and the anatomy of the occlusal surface is maintained. Now when we start about the axial reduction, we place the grooves that are aligned to the axial long axis of the tooth, and they are deep occlusally but shallower toward the cervical margin. And we do the reduction half of the tooth to evaluate the thickness when we have a half of the tooth that is still intact. These are the grooves on the sides. We put them on 3 sides, and we maintain the proximal side where we have a contact with another tooth, and we will see now how we will do the preparation for this area. We do what is called a lip of enamel, that we maintain this thickness of enamel to protect the adjacent tooth from any damage, and this is so important. That will determine the longevity of the preparation of the restoration afterward. This enamel can be at the end removed with any instrument, whether it is an explorer or any metallic instrument. The chamfer margin must be at least 0.6 from the proximal surface of the adjacent tooth. It means that this is the chamfer margin. We must maintain 0.6 millimeter of space to give space for the proximal contacts to be built by the technician. We do an evaluation from the occlusal appearance. We see the chamfer that is smooth, continuous. We see that the angulation of the sides is not more than 6 to 10 degrees that are parallel and almost 90 degrees. We see that the reduction of the occlusal surface is more on the non-functional cusps rather than the functional ones, maintaining the occlusal appearance of the original teeth. We see that we have a rounded angles throughout the teeth, and this is the lateral view. The end is a step is the finishing of all the prepared surfaces to get a slightly round all line angles. We can use only the air cooling to improve the visibility with using a water spray from time to time to prevent the dehydrating and to avoid the possible pulpal damage and to wash away the debris. The larger diamond of the red finishing one is recommended because it will eliminate any unwanted ripples and will remove any unsupported enamel at the margin of the teeth. When we have a mesially tilted molar or teeth and we have a short premolar, it is beneficial to use the grooves or the boxes during the preparation where we improve the resistance form. It is noted that this is subjected to a metal restoration and not for the ceramics. This is the completed preparation that is a smooth chamfer margin, 6-degree taper, and the gradual transitions between all the prepared surfaces. A common error is that the over-tapering of the opposing axial wall, which will create the undercuts and will make the significantly reduces the retention and the resistance of the completed restoration. These undercuts should not by any circumstances be maintained, and they should be removed by additional tooth preparation or blocked with a suitable material. Also, the chamfer margin is the choice of these types of restoration. We should not exceed its thickness more than 0.5 or 0.6 to prevent having any enamel that is not supported and prevent making this area a weak area that will be subjected to failure or fracture in the future. Salam.